Hi, everyone. This is Beth Rogan from the Marketing and Communications Department at William James College to welcome you to our Master's in Clinical Mental Health Counseling online webinar today. Thank you. Thank you for joining us during your lunch hour. We have a nice group of folks on today, and we're excited that you have joined us for this really exciting program. I will be acting as your host today, and what that really means is I'll be providing an overview of some information about William James College and just kind of moving things along a little bit. We have wonderful presenters today. So we have Melissa Cohen, who is the Associate Director of Field Education for the Counseling Department. She'll talk more about herself and give you a little bit of a history of all the wonderful work she's done. She's also the director of our Behavioral Health Initiative, and she'll tell you a little bit more about that as well. And then Joseph Lush, who is our Associate Director of Admissions, and further down in the webinar, he will be talking about things to think about in applying to graduate school, and then in particular around what you would want to do in terms of applying for William James College. And he is also our tech guru, so he's managing the slides in the program today. And I'm Beth Rogan, the Associate Director of Marketing and Outreach. So again, we're excited. We can go to the next slide, Joe. And what I always love to say here is there's a nice group of you on today. Please ask questions. It really helps us to make this webinar your webinar because they're not always live. And every question's important. If you're thinking about it, somebody else is too. And it helps with our engagement. So please do that. Put your questions in the question box. We also have in the handout section, you will see that there is a PowerPoint that you can download for this particular program today. So you can download the PowerPoint. You won't have to take as many notes if you'd like. So that's a little present that we will offer you today. So this is a facade of our beautiful campus located in Newton, Mass, William James College. It is a state-of-the-art campus, and meaning state-of-the-art, there's state-of-the-art services, technology, but this is where I really like to say the culture and what's inside the building is really what's important. And we have a wonderful academic and culture here, and just a community culture with staff and faculty, students, all of us. And we really do represent a lot of important goals and ideals in our mission, and you'll hear a lot more about those. So we're located, as I mentioned, in Newton, Mass. We're off major highways and byways. It makes it easy for anyone coming onto campus, free parking. But again, it's the services and the activities that happen here in the building. So feel free to connect and with our admissions folks and talk to students and faculty, and we'll tell you more about how you can do that as we move forward. Next slide, please, Joe. So just in giving you a little bit of overall information and providing sort of a sense of William James College and some of the things that we really feel set us apart from a lot of other schools of higher ed. As you know, we are a school of psychology and behavior health. That's what we do. So we're really good at that. But we also have very, very important core values that we want to share today with you. So one is experiential education, and that is something that has set us apart since our first program, that the clinical PsyD program about 50 years ago. So our students really are able to apply their coursework to their experiential education, their practicum and internship. And so it's applied. It's an applied model, and you're able to take what you're learning in your coursework and then utilize it in your practicum. And that's something that's really valuable. And we have lots of supports around our experiential education in that department, and you'll hear more about that when Melissa comes on in a couple minutes. Social responsibility is key to our mission here at William James College. It's so important for all of us because we really look to see how we can meet a need and make a difference. And what does that mean? Well, it means that we look at underserved populations and how we can equip our students to become mental health clinicians and counselors and psychologists to take care of and help really address the need around mental health and behavioral health. So you'll see that as we move forward. And this program certainly does this because it's going to help increase the barrier by increasing the amount of clinicians that are out there to provide support and guidance, especially during this very important time now, in this very unprecedented time that we're living in. And then personal growth is something that, of course, as maybe someone who's inquiring about a program, you want to know what happens if I come into this program. How am I going to grow? How am I going to learn? And how does that take place? And Melissa will tell you a lot more about that. But one of the things I will tell you is that you're not a number here. It's a very, very high touch program. And you are one of a small cohort. And you are one of our professors have about a 1 to 12 or less advising ratio. So you're very well known. You're mentored by our professors who are a practitioner faculty. That means they are out doing the work and they have many, many different expertise and they provide mentorship because they've experienced what you want to learn and they're out there doing it every day too. We have a very, very strong commitment to diversity. It's very important in that we look to train a diverse population, to serve a diverse population. Inclusion, social justice, and intercultural understanding. I touched on social responsibility, and those key components are very important to our culture and to those who are educated here at William James College and trained here. All right, so now we'll move to the next slide, and this is where I very happily get to introduce you again to Melissa Cohen. And I'll turn over the presentation now to Melissa.
Thank you, Beth. Appreciate it. Welcome, everybody. As Beth said, I am Melissa Cohen. I'm the Associate Director of Field Education in the Counseling Behavioral Health Department, as well as the Director of the Behavioral Health Initiative, working with students who work in the behavioral health field and attend our on-campus program and helping them work as their job as placement for their practicum and internship experiences. Coming to the end of my third year here at William James College, and I am loving it. I love the position that I'm in. I'll give you a little background about myself and kind of my journey in becoming a licensed mental health counselor. For about 20 odd years, I worked in a therapeutic day program that served individuals, children, adolescents, transition age youth with major emotional, behavioral, intellectual disabilities, and worked with them individually, in groups, crisis intervention, worked with their families, did home-based services, as well as accompanied those individuals who were court involved and developed relationships with probation officers, judges, and community health workers as well. So I did that for, as I mentioned, about 20 years, really providing that clinical intervention and utilizing the skills I developed while in my own grad program. And then throughout the years also started to become more of a clinical supervisor and administrator, and that is something that I continue to do here at William James. So I'm able to work with students and helping get them placed in their field training positions, but also teach one of the practicum seminar classes, so engage with students in how their field sites are going and provide group supervision for those individuals and help them to develop their skills in work on identifying ways that they want to kind of shape themselves into what type of therapist or counselor they want to become. So the journey from, being a practitioner in the school to now being a school administrator and instructor has been a long one, but one that I've enjoyed greatly. And working at William James is like being in a small family where I really find it's a unique experience for students in graduate school level training, because there's really a lot of one-to-one individualized attention that students receive. It's extremely helpful in navigating just graduate school in general, as well as being able to have the opportunity to engage with faculty and in-depth discussions about any of the academic courses that you are involved in, as well as your field training site. And for the online program, that will also be in existence. You'll have that opportunity to be able to engage with the faculty that teach the courses, but also being able to have the opportunity to do some field site experiences. And I'm sorry, I'm just getting a note that maybe having network difficulties. Can people hear me okay?
We can hear you, Melissa.
Okay, I
I
just want to.
I can hear you fine. Yep.
Okay, I just want to make sure if something goes out, if people can just let me know, I appreciate it. So I just really think that the experiences that you receive on the online program, is just, the same amount of attention and connection and relationship with those within the on-campus program as well. So that's a little bit about me, and I'd love to be able to now give you, some more discussion about the online program. So Joe, thank you. So for the online course of study for the program, just kind of a brief overview is that it is a 60 credit program, and there is a practicum and internship field training component to it. There are two entry points, one being in January and one being in August. The time to completion varies depending upon when you start. For instance, if you're starting, let's say this coming August, the program takes 3 years, where the first year you're doing academic courses, then there is a 2-week summer residency, and in preparation for your practicum experience for that next upcoming year. And then again, another academic year with practicum, and then the following summer, another 4-day residency for your internship preparation. The coursework is all asynchronous classes, with the exception of the clinical seminars for your practicum and internship. Those would be, live Zoom sessions with the faculty, and they occur weekly, 2 hours per week. And that's really to provide that opportunity to really kind of have the group supervision and being able to talk about how things are going in the field with the different challenges that you may face, being able to work on conceptualizing cases, but learning from each other within the cohort as well, to be able to learn from other people's experiences and how you can maybe even incorporate some of those situations or challenges that they may face. There's also, prior to the start of the program, an online orientation, and that also occurs generally, before, maybe a week or two before classes start as well. And that just gives you a really good idea of some of the information that I'm speaking about now, but again, also about how to engage within the program, engage with the faculty, as well as take advantage of, situations or programs that are also offered, on the campus of WJC. Also, as I mentioned, the first summer residency prior to your practicum training year, you'll be also taking 2 courses. Those would be, diversity and group counseling. And then the second summer is the internship level training preparedness. In this program, there is currently no area of emphasis or college-wide concentrations. It's a general track program where you, though, are getting a really good overview of the mental health and behavioral health field. Following the counseling behavioral health competencies, similar to our on-campus program. So the program meets all the requirements for the licensed mental health counselor in Massachusetts in the New England area. And also we have had graduates from our on-campus program go on to, move to other states, and the requirements, for the most part are equivalent to those areas. If there are specific, states that students may be living in, we work together to, see what courses may be required in addition to the ones that we cover. For instance, I know in Florida that there is a human sexuality course that Florida requires as part of their licensing requirements that Massachusetts does not require. But there are ways that students who then know that they're going to be in Florida are able to take other online classes through other college settings. The classes for the online course last for 7 weeks. And as I mentioned, the seminars are held on Zoom, and they're 2 hours, and those are for 15 weeks, but all other classes are for the 7-week duration. And the faculty will be available for weekly virtual hours as well. And the course sequences are published on the webpage, so it gives you more of an idea of the actual courses that are taken each academic year. And then also too, at the prior to probably the spring of your 3rd year or your 2.5 year, if you started in August, there is a comprehensive exam that's required prior to meeting the requirements for graduation. Next slide, please, Joe. So just a little bit about the field education hours and the time commitment. These are specific to the Massachusetts and New England area requirements, but in year 2 is when you would be in your practicum experience. That is for roughly 12 hours a week for 30 weeks, and that's for the duration of the academic year. At the end of that year, you're required to have accrued 360 overall hours, and of those overall hours, 90 of them need to be direct client contact. And then for your internship year, which is then 20 hours, roughly 3 days a week, again for the duration of the academic year, and overall hours is 600, and direct client contact is 240. And so in my role as the Associate Director for Field Education, I work with all students in helping them through the practicum and internship search process. So unlike, other programs that, may, ask students to, to find a site on their own, I really work closely with the students to be able to help them be able to identify a site that fits their needs, as well that is open to the training process for students, has the appropriate supervision in place, and really also the supports and being able to coordinate and collaborate with the faculty within our program. So with those who are in other states, we also have partnerships with some of the sites through our clinical program, where we have students in, postdoc positions or 5th-year internship positions across the country. So we're also developing connections with sites for more of a master level position and training. Within Massachusetts and New England area, we have over 300 plus sites that we have partnered with, and being able to do training in various locations, such as school-based mental health counseling, also community-based, in-home services. There's also sites that we work with that are, kind of a little different in regards to some animal-assisted therapy type programs. So really working to get a good range of of services, as well as those in areas of high need in those communities with underserved populations. We work to, develop connections and partnerships to be able to have students with diverse cultural backgrounds be able to provide services to those who are in similar cultural areas as they are, as we know that there is a high need for mental health clinicians in all areas. And now with the pandemic occurring, I anticipate that there'll be even a higher need for that as well. Next slide, please, Joe. These are just some examples of some of the partnerships that we have. Some have college settings in the counseling career centers. Others, as I mentioned, are community mental health agencies, residential group homes. Also, we have some affiliations with the Department of Corrections within the Massachusetts area, and being able to provide services to inmates in various levels of security, and then also to some partial hospital programs in inpatient psychiatric areas. So as I mentioned, we have sites in Massachusetts, New Hampshire, Maine, Connecticut, and Rhode Island, but are also developing relationships across the country as well. Okay, next slide. This gives you a brief overview of the Behavioral Health Initiative, which is a partnership with community mental health agencies, as well as some therapeutic schools and psychiatric hospitals and partial hospital programs. So it's working with individuals who may have a bachelor level degree and maybe in an entry level position in one of these agencies, and would like to also count their practicum or internship training as their job as placement. And so we work together with administration at those agencies and work to make sure that, one, that they are, committed to having their employee be able to have the flexibility to, do their academic coursework as well as their field training. And in some situations, the field training may be separate from their actual job responsibilities, depending upon the type of position that they hold at that agency. And being on the online program, I know that that means then that there are students who are, working potentially full-time during the day, but you definitely want to make sure that you have conversations with your employer so that they know that you're involved in a rigorous academic course load, and that, you do need, that time as well to be able to, focus and work on, some of the class assignments and discussion boards that you'd be responsible for during that time. So those students who are able to do that and have that ability, the Behavioral Health Initiative also allows a tuition discount. It's a 20% per credit discount. So here it would be discounted to $904 per credit hour. So it's definitely, a good opportunity, and one that, again, I work individually with students to be able to identify if this is something that would be possible for them and their employer. And then also too, some of those positions may be in as like a mental health counselor in a residential facility. It may be as a, community support worker. Each title kind of, is different within each site, depending upon how they may categorize those positions. So if anyone ever has any questions about, well, would my position, meet those requirements, please, email me, and I'm happy, to talk more about it with you in those situations. Okay, next slide. And so this is just a slide that really kind of gives you an overview of career opportunities for those working and thinking about, being in the mental health field, and knowing that there's always a need. There's always a need for someone to reach out and talk to someone else and talk about the struggles that they may face, or the, the deep kind of clinical needs that they have, and how to work through those to live a more productive and successful, life in whatever way that may be for that particular individual. So it just really gives you a good idea that this need exists across the board in many, many different areas. There's, those working with couples and families. There's those working in community health agencies, an increase in the need for social and emotional learning and in schools, and working with children in middle school age and adolescent age, working within college counseling centers and helping those, working through the transition from high school age to now undergraduate or being a first gen student, and just really, trying to manage many different pieces of their lives and, further their education. And then there's also, as I mentioned too, those in the forensic field that may, want to work in correctional facilities or in programs that work with individuals who have been affected by violence, or have, been, in need of kind of after being released, being able to access services that continue to help them to grow and work to, better themselves. We also have affiliations within various veteran sites, so working with those who are currently in the military and those of our veterans who are in need of assistance in a wide variety of areas, including homelessness, substance use issues, as well as helping them work, with their families and, kind of doing different transitional periods of struggles that they may accompany or they may experience. So as you can see, there's just a wide range of possibilities of, as being a licensed mental health counselor or a licensed practitioner. Each state has various kind of I'll say acronyms that go along with who a licensed practitioner is. So it's important to be able to look at your own state's requirements and name for that particular area. On the WJC website within the Counseling Behavioral Health Department, there is a link that gives you all the states licensing board web pages, and gives you that opportunity to be able to see specifically what requirements are necessary for each state. But also too, you can email myself or Dr. Nilda LeBoy, who's the director of the Counseling Behavioral Health Department. She also works with our graduates when it comes time for applying for licensure and they're in other various states. She works with them one-on-one, again, to help them through that application process. So I feel what sets us apart from other graduate programs is that individualized personal attention. I know that when I went to grad school, I was in a much larger program, and so it was hard to really kind of feel part of a small group or a small cohort, and being able to kind of feel that I had the opportunity to touch base with people or talk to people for if I needed assistance or support. And here at William James, you definitely receive that. There's a lot of supports. It's, as I mentioned, like another family. And the faculty are very engaging and very open and welcoming in helping students being able to manage many of the different areas that that they come across when they're working on their academics as well as within the field training. And so next slide, I can talk a little bit about the career services as well at WJC. So we have a dedicated staff person who works with students and alumni as well on talking about, career paths, helping, to make some decisions and transitions, also work together with them in editing resumes or cover letters for post-grad job opportunities, as well as helping them to develop their LinkedIn and online presence, practicing interviewing, role playing, negotiation strategies, and also providing different opportunities for networking and connecting with alumni and employers for future job opportunities. So again, just a really great opportunity and experience as part of our programs here at WJC. And Beth, did you want to discuss some of the other degrees offered?
Sure, thank you. Okay, so what I just wanted to do now is just give you a little bit of an overview so that you have a sense of, how dynamic William James College is and just the degree of programming. So you heard Melissa talk a lot about the counseling department and the programming there. And also we do have in that department a actually on-site clinical mental health counseling program in addition to the online program. So you probably have already discovered that. But in addition, we'll talk about the doctoral program, which is a 5-year program. We also offer, which is a clinical PsyD program. Organizational leadership psychology, that department. We have a doctoral program and master's as well. And our students and our faculty are working within organizations to make assessments and create positive change, humane environments, and so on. And that's actually where our first online programs originated way over 10 years ago. So there's a lot of experience in the online modality at William James College. And we have a undergrad program for a BS in psychology and human services. Our students come to us with the equivalent of an associate's degree and are generally in the workforce, and the program is online and blended. School psychology, we have a MA CAG, so that's a school psychology program, 3-year program, as well as ABA. In addition, we have many centers of excellence and a lot happening within those centers, like, for instance, direct care, research, academic work, advocacy, and so on. So there is a lot to draw from, and because we are a school of that really specializes in psychology and behavioral health, we do have so many resources around that, and we do provide. We really are thought leaders in the field at William James College. So, just wanted to highlight that for you all. And now we can move to the next slide, where Joe will be talking about applying to William James College.
Thank you, Beth. Welcome, everyone. My name is Joseph Lush, Associate Director of Admissions. Happy to be with you today. So I'd just like to now switch gears for a moment and offer to those who are considering an application for admission to William James College a basic overview of how the application process works, as well as a summary of all of the documents that are required to complete your application portfolio. And then from there, I'll just take a couple of minutes and talk about the various financial aid opportunities that we make available to our candidates. So before we begin, I just want to advise everyone who may be interested in applying for admission about the timing of your application. So applicants may join the program that we're talking about today, the Clinical Mental Health Counseling Program, at 2 points in time during the academic year. So you can enroll for the start of our fall 2020 term, which begins in late August of 2020, or you can begin the program at the start of next year's spring term, which begins in early January of 2021. So if you're interested in applying for fall 2020 enrollment, now is actually a good time to apply. We'll continue to take applications for fall 2020 enrollment well into the spring and even into the early part of the summer. But now is a good time to apply to that program. Give yourself plenty of time to compose your application essay, get your transcripts sent to us, and think about a financial plan for the program. So if you're ready to apply for fall 2020 enrollment, you can submit your application now. And a complete application portfolio for the Clinical Mental Health Counseling Program will consist of an online application that will include a reflective essay. We'll ask you to furnish us with your official academic transcripts, and also we'll ask you to identify 3 individuals who will serve as references on your behalf. So you can access the online application through our main website, once you open the application for the first time, you'll be assigned a PIN number, and then you'll get to choose a password. So use this PIN and password to then work on the application at your own speed. Work on it for a period of time. You can save the information and then come back to it. You can do that as many times as you need to until you're satisfied that the application is ready to go. So don't feel compelled to do the application all in one sitting. So once you decide to apply for admission, that's a good time for you to contact the registrar's offices for each post-secondary college or university that you've attended, and then just ask them to issue your official academic transcript directly to us at the college. And it's perfectly fine if those transcripts arrive ahead of your application being submitted, so don't worry about that. Once the transcript comes in, we'll log that, and then we'll attach it to your application once it comes in. So regarding letters of recommendation, I just want to say a few words about that. We don't actually have a firm policy as to whether references must come solely from academic or professional sources. So the choice of an academic or professional reference will really depend largely on where you are in terms of your career path. So if you're an individual who is about to graduate from your bachelor's program, or maybe you've just been away from your bachelor's degree for about a year or so, and you're employed full time, you might want to think about approaching some academic references from your bachelor's degree program. So a traditional source of an academic reference is typically a college or a university professor, but other possible sources of academic references would include academic advisors, department chairs. If you were involved in a practicum or an internship, those supervisors of those experiences, all of those sources typically make for really good academic references. Now, for those of you who have been away from your undergraduate program for, say, a period of several years, then you most likely have lost contact with those academic sources. So it's perfectly appropriate for you to then look to professional references. And it's important to note here that a source of a professional reference does not necessarily need to be employment related. So, for example, if you've served in some volunteer or public service capacity that was related in some way to the field of psychology or human services, I would certainly encourage you to consider those sources. Volunteerism and public service, working with underserved members of the community, that's really kind of a big part of our culture here at the college. So think about those interactions that you've had in those settings. So those individuals could also make for really good references to serve on your behalf. And just a reminder that an interview is required as a condition of admission to the clinical mental health counseling program that we're talking about today. Interviews are set up by appointment, so we'll schedule them shortly after your application becomes complete. So, again, I would encourage you that once you've made a decision to open an application for admission and to submit your materials, do that right away, because as soon as we have all of your materials received, your transcripts and your references, it's just a very brief period of time before we'll be able to then read your file and then consider you for an interview. So your interview will most likely be hosted using the Zoom video conference platform. And the format of the interview will most likely include a brief group activity. So we'll most likely interview you on a day that we'll be interviewing other candidates for admission. So we'll invite you along with other candidates to participate in a brief group activity. And we'll also ask you to complete a brief reflective writing exercise that will only take about 20 minutes for you to complete that writing exercise. So that will all be part of your interview experience. From start to finish, your interview should be completed in roughly about 30 to 60 minutes of time. That's really all that we need to get through the interview process. Okay, so let's move on now and talk about some scholarship opportunities that we make available to our applicants. So I'm very pleased to tell you that the college has several merit-based scholarships to offer to candidates who are admitted to the Clinical Mental Health Counseling Master's Program. And these scholarships are actually awarded by the faculty members who host the interviews with our candidates. And these scholarships typically carry a value of approximately 10 to 15% of the total tuition and fees for the program. Now, the good news is that for a merit scholarship, there's no separate scholarship essay that you need to write. There's no financial needs test that you need to meet. So basically, when you're invited for an interview, you're automatically placed into the pool of candidates for scholarship assistance. And if you're the recipient of a merit scholarship, you'll know the answer to that when you receive your offer of admission. So right in the body of the letter, the offer of admissions letter, if we're making an offer of a scholarship, you'll see the dollar amount of the scholarship, and that will be mentioned right in the offer letter. And so as Melissa mentioned earlier in the presentation, we have our Behavioral Health Initiative Scholarship. And just a quick overview about that. That scholarship is offered to candidates who are already employed in a human services or a behavioral health work setting, typically as an entry-level caseworker or a clinician or a counselor. And the value of that scholarship is a 20% reduction in the tuition for the Clinical Mental Health Counseling Master's Program. So for those of you in the audience today who are already employed in that type of work setting, be sure to mention this experience in your resume, and we'll see it in your application for admission. And then if we offer you admission to the program, we'll then help you to negotiate that agreement that you need to have with your employer so that you can complete your field experience at your employer's work site. And provided that your employer agrees to all of those terms, you'll then benefit from a 20% tuition reduction. So in addition to scholarship opportunities, we have a couple of other financial aid programs as well. And those consist of part-time on-campus student employment. And then we also offer financing through the U.S. Department of Education's Federal Student Loan Program. And so it's worth noting here that online students, just as on-campus students, they have full access to all of our campus-based student services. And one of those services includes the opportunity to apply for on-campus work study positions. So if you're an individual who, when you join the program, if you're not working at that time and you're interested in part-time employment, we have many on-campus employment opportunities, and they vary between administrative and research-related positions. And so when you become a student in the program, we'll direct you to a page on our website where you can look at those open positions. And there's a brief application for employment that you would complete. And of course, you would have to have a brief interview with the hiring supervisor. So these on-campus student employment positions, they typically pay an hourly wage, and a typical work schedule is usually about 8 to 10 hours per week. And so in a given year, a student might earn from student employment anywhere from $2,000 to $4,000 in wages. And that, of course, would be dependent on your individual work schedule. And then finally, there's the opportunity to access financing from the Federal Student Loan Program. And so to qualify for this type of financing, you must be eligible to file the free application for federal student aid, commonly known as the FAFSA. And as far as the timing of your FAFSA, it's usually a good idea to work on your FAFSA right after you've submitted your application for admission. So if you're thinking about financing a program such as this, and most of our students do in fact finance most, if not all, of the cost of attendance for this type of training program, do your FAFSA right after you've submitted your application, and while you're making your way through the interview process. When you reach the end point of that and you receive your offer to enroll, if we have your FAFSA results by that point in time, you'll then receive a financial aid award letter from our financial aid team here at the college. And that financial aid award letter will describe the total expenses for the first year of enrollment in the program, and then we'll give you some financing opportunities from 2 federal student loan programs. And that's the Federal Stafford Loan and the Federal Graduate Plus Loan. So those 2 loan programs combined will allow you to finance 100% of the cost of attendance if you're an individual that needs to finance 100% of the cost of the program. And also, in addition to financing the billable charges for the program, you can also finance certain out-of-pocket expenses that you have that are related to graduate school enrollment. So those expenses would include textbooks and the purchase of technology, such as a laptop, for example. You can finance your expenses that would be related to the travel back and forth to your field site. And if you're a student that requires the purchase of health insurance, you can actually use your financial aid to purchase health insurance as well. So that's about all that I have for financial aid opportunities. So now I'm going to turn it back to Beth, and I think we're ready to take some questions.
Hi, Joe. Thank you. Well, Melissa and Joe, I think you provided a lot of information and probably answered a lot of questions already. We don't have a lot of questions right now, but we still have time. So please put your questions in the question box. Joe, and good, so a couple are coming in. Joe, there's one question around, is there a specific deadline for the fall semester?
Actually, we don't have any official deadline for applying for the fall semester. So I would recommend that you apply no later than maybe late June to early July of 2020. And the reason I say that is because you want to allow for some time for all of your supporting documents to come in, such as your transcripts and your references. And you'll also want to allow for some time to organize a financial plan for enrolling for the program. So while we can technically take an application right up until just a few weeks before the start of the semester, don't put yourself under that kind of pressure. Submit earlier, take your time, go through the interview process, get your offer to enroll, put together a financial aid plan, speak with our financial aid team, give yourself that luxury of time to get everything set. So when you start the program in the fall, you're not worried about finances or things like that.
Okay, great. And then let's see, do you think, would you say there are any pros or cons to any significant differences to August versus January matriculation, both in terms of academic learning and the application process? So I guess this is a Joe and Melissa question.
Yeah, Melissa, do you want to
Sure.
respond?
Sure, yeah, I'll answer that. So I think it generally comes down to you as a student, and also to in a sense in regards to what your current schedule is, as to what the best kind of opportunity or time is to start this journey. Generally starting in January, from January to throughout the summer, you would then be really focused on again, initial academic work. Same though when you're coming in through August, your first year is all academic work, whereas your then field training doesn't start until, then the following year. If you start in January and you do the academic work initially in the spring and then summer, and then you start your practicum then that fall. So I guess could kind of see it as you're starting a little bit earlier when you enter in the January cohort for your field training. But I don't think there's really a pro or con between either start. It's really, again, what fits the needs of the individual student and kind of the maybe various pieces of your personal life and responsibilities that you're juggling to be able to be as successful as possible.
Yeah, I would tend to agree with what Melissa said. There's really no material advantage to being in either cohort. The cohorts for the fall semester can be slightly larger than the spring cohorts. Aside from the relatively minor difference in the size of the cohort, your experience will be essentially the same.
Okay. So there are a couple questions here related to kind of the PsyD and this program being kind of a precursor to that, if you will. So one question is, how often do people start with this program and then move into getting a PsyD at William James? And then the next question, which is similar, my question is, while I'm in the master's program, if I decide to go for the PsyD, will that be a different process, or will the classes already taken count for part of the PsyD program? Melissa, do you want to take a stab at that?
Sure.
Yeah.
Well, I always feel for those individuals who are, interested in pursuing their PsyD or, PhD in the field, it's helpful and important, I think, to have some, prior experience, in the field to be able to really kind of apply more of the academics that you will be, learning, and having then the master's allows you, that opportunity to have the exposure to the graduate experience, to the academics, as well as to the field training. And going from, our master's program into our PsyD program, there's still the application process, still need to have, the interview. There are other requirements for their admissions materials. And then also too, if you are offered admission to the PsyD program, you are in what's called advanced standing, because you're coming in with the master's level, degree prior to starting the doctoral programming. So that's one component of going from our master's program to the PsyD program. I think there was another part of that question, but I don't know if I answered it fully.
Yeah, it was just more like, how often do people start with this program
Sure.
and move in? Yeah.
Sure. I mean, and I think, again, it varies depending upon, the individual and some of the experience that they have. Some students, go, apply to a doctoral level program right from undergrad. Some, and some of those students have had experience in whether or not in their undergrad in a type of field training or in regards to research opportunities. So they've worked with other professors or faculty that have ongoing research. So they have, some knowledge of various areas that they then want to apply within the clinical programming or the doctoral programming. And then there's others, as I mentioned, that have worked for several years after undergrad and are in the field, and want to now pursue more of a doctoral level academic achievement and do more various either assessments or, research type opportunities at that level, and be able to teach as well in undergraduate and graduate programs with the doctoral degree.
Okay, so Jennifer is asking, would an MPH count towards advanced standing for the PsyD, or does the master's need to be in counseling?
MPH, meaning a Master's of Public Health.
Public health, I'm assuming that's, yes, what it
Um,
means.
I'm not 100% sure. Again, I think the best thing to do would more than likely look at the admissions, or excuse me, the application materials for that specific program. I don't want to give false information, Joe. I don't know if you know that answer better, if they need to have the master's in a psychology related field, or
Yes, I think I can offer some clarification here. The requirements for advanced standing are actually fairly narrow, and they're fairly rigid. So candidates for advanced standing need to graduate from a minimum 60 credit hour program, which is typically in clinical mental health counseling or clinical or counseling psychology. So unfortunately, a master's in public health, it would not qualify for advanced standing, but it could possibly still give you some transfer credit into the doctoral program. So when a candidate for the doctoral program has some graduate coursework that is related to the study of clinical psychology, we can transfer in up to 12 credit hours from another graduate program. And there are several conditions that need to be met for the transfer of credit. We need to look carefully at the course syllabi to make sure that the learning outcomes and the competencies match the learning outcomes and competencies for the courses in our doctoral program. And there has to be a minimum grade that has to have been earned. And the course must have been taken within 5 years of the point in time when the student would actually matriculate in the doctoral program. So I won't rule out fully that there's no transfer of credit in this situation, but I can tell you with certainty that a master's in public health would not qualify for advanced standing, I'm sorry to say.
and I think just to add to that too is that I know we do have the online masters in psychology, and so many students who don't have a lot of psychology courses do take go for that master's to help them kind of have more in-depth programs or courses within the psychology field that then helps them in then the applications for doctoral level programs.
Great. And the other question, is there a minimum score required for the GRE?
Sorry, go ahead.
Yeah, I was going to say that the good news is that a GRE is not required for admission to the clinical mental health counseling master's program. It is a requirement for admission to the doctoral program, however. However, if you're a candidate who has taken the GRE, a preferred or desirable GRE score is a combined verbal and quantitative reasoning score of about 305, and a preferred or desired analytical writing score would be a 4.0 or higher. But again, the GRE is not required for admission to this program. Relatively few candidates will furnish GRE scores for this program, but it's still an important measurement of academic readiness for graduate study. So if you're an individual who has taken the GRE, and if your scores are within the range that I had mentioned, I would certainly encourage you to include that as part of your application portfolio.
Okay. So we do not have any other questions, and we're at 1 o'clock or a little bit after. So I think we can move on to our next slides now. Okay, so of course this slide is one in which we're providing contact information for you. Melissa obviously would be happy to answer any more questions for you, so please feel free to email her or Joe if it's a related question at info@williamjames.edu. And Hillary Baxter is the Director of Financial Aid, so she would be able to address any questions you have around that. And then in terms of our next slide, feel free to follow us on any of those social media platforms. I think you'll get a really wonderful sense about all that is happening in William James and the individuals that follow us and are involved in the community. So please feel free to do that. Our website has a lot of information that would be helpful for you. And Melissa, is there anything you'd like to close with?
I was just going mentioning the some of the resources available online during the COVID pandemic. You know, there are many things that our faculty and staff are doing in supplying resources and support groups and drop-in sessions and some online you know, kind of training opportunities. So I encourage you to check those opportunities out. Many of them are for frontline resources providers, as well as various groups in regards to, you know, families, you know, working, you know, or having some, you know, transition issues with their children during this time. Also for those, you know, older age population, and then also to situations working with schools and you know, just, you know, anyone really kind of struggling with, you know, managing the impact that this pandemic is having on people's social, emotional, and you know, psychological areas. So I encourage you to please visit our webpage and look at all those resources that are available. I thank you very much for attending and listening to all of this information, and please encourage you to reach out to me. I'm happy to, you know, converse through email or set up a Zoom time individually to, you know, give you more information about the programming as well as the field education components.
Thank you so much, Melissa. Joe, would you like to finish with any final comments?
Yeah, certainly. So yes, thank you all again for tuning in today. And you know, I think that most applicants find our application and interview process to be fairly straightforward. But if there's any special circumstance or unique situation that you would like to you know, discuss with us here in the admissions office, I'm happy to have a conversation with you. And happy to spend some time and strategize about how to put together the best possible application portfolio that you can. So feel free to reach out to us, and we'll be happy to have a chat with you.
Great, thank you so much. Thank you everyone for joining us today, and feel free to again visit our website. There are other webinars coming up. The admissions on the admissions menu, the drop down will provide you with a link for those and information. And thank you again. We would love to see you here joining our community at William James College. Thanks again for your time today.
Thank you,
Bye
folks.
now.